Hey guys, my name is Bella and welcome to my Instagram. I am making this Instagram profile so I can help keep people updated with all my health problems, and I can help spread awareness and educate people on my condition and what it's like to live with Vascular Ehlers Danlos Syndrome. So I'm going to talk about what it is, how I got diagnosed, and kind of get you oriented to this profile. So I have this condition, vascular Ehlers Danlos syndrome. It's a connective tissue disorder, and the collagen that my body produces is defective. And it's the collagen that's in my skin, in my blood vessels, and my major internal organs. So, because they're so weak, my tissues can tear spontaneously, and collagen's what holds the tissues together. And so I'm prone to aneurysms, artery dissections, colon ruptures, a bunch of issues without any trauma. So it can just happen spontaneously because my body just falls apart. And I'm 25. I was diagnosed with this when I was 10, mostly because of my mom's persistence. When I was born, I would have spontaneous bruises, and you can see the blood vessels on my arms, my chest, my legs. They call it a road map because that's how you can see all the veins. And my mom thought that this wasn't normal, so she kept pushing to get me tested for something, and they told her she's fine, she's a kid. Kids injure themselves, they run into things, they're hyperactive, and she was like, no, my daughter's not hyper. And so they did blood work when I was 5, and it came back abnormal, so they sent me to a hematologist oncologist, and from there he did more blood work and testing, and they diagnosed me with von Willebrand's disease. And with that, my blood doesn't clot like it's supposed to, so I'm prone to bleeding, a lot more nosebleeds, and my blood takes longer to clot and to stop bleeding than in normal people. So I had that diagnosis when I was 5, and as I was getting older, my mom just kept noticing things that weren't right and normal, because she's had 2 older kids and they didn't go through any of this. And there was one time when I was 10, I was walking on a dugout at a park. I slid down the fence, and what should have just scraped my knee, because my knee just slid down the fence like this, the chain link fence, my knee split open, and I had to go to the ER to get stitches. And when they were doing the stitches, I wasn't numbing well, so I was feeling all the pain, and they just told my mom that I was a crybaby, and my mom was like, this isn't right. And I didn't bleed as much as I should have for having a bleeding disorder, so she insisted on me getting some more tests. And it turns out that my doctor considered a connective tissue disorder, so he did a skin biopsy, and they sent it over to the lab in Seattle, University of Washington, and it came back positive for vascular Ehlers Danlos syndrome. So I received that diagnosis when I was 10, and that's how I got diagnosed, which I'm pretty lucky, because a lot of people with vEDS, as we call it, vEDS for short, they don't get diagnosed until they have a major complication, such as a bowel perforation, an artery dissection, or if a family member passes away from it, they get diagnosed post-mortem, and then the rest of the family members get tested. So I was lucky to get diagnosed before something major happened. So that's how I got diagnosed, and a little bit about the condition. But if you keep following my page, I'm going to tell stories about what I've been through, my major complications. I'm going to keep you guys updated anytime I go to the ER, just kind of teach you guys, and you can follow me on this journey with vEDS. It's very unpredictable, keeps me on my toes for sure. And I guess a little bit about me, just to share. I'm a nurse. I also have a psychology degree, and I haven't been able to work yet because of my health issues, which is a story for another time. But my main thing is to be an advocate for other people who have vEDS, and help them not go through all of the issues that I went through. Because when I was first diagnosed, I was the only one in El Paso, Texas that had it, and we didn't have any resources to kind of guide us in any direction. So it's been a journey, a learning process, and I hope to help others that are like me, and to help spread the awareness, because there is a lack of awareness. It's a rare condition, and doctors have studied about it in med school, never seen it, and nobody knows how to handle it. I also just wanted to share quickly that this Instagram is for you guys to help to learn about vEDS and know about what I go through, because not everybody is with me all the time, and even my closest friends don't know everything that I go through. So if you have any suggestions on what you would like me to share, questions about vEDS, please ask me, and I want to make this profile as interactive as possible, and I'm going to be pretty open with you guys. So I have a whole long list of stuff that I do want to talk about, but if you have any questions that pop up, please message me. And I'm going to try to keep my videos as short as possible, because I know everybody has short attention spans. I can't listen to anything. But in my bio, there's a link to a podcast, and the girl, her name's Katie Wright, she also has vEDS. It's her podcast channel because she's also trying to raise awareness, and she interviews other vEDS patients, so you get to hear their stories. We've just all gone through a lot of different issues, even though we have the same condition, which is what makes it even harder to diagnose. And if you would like to kind of get a preview and overview of what I have been through, you can go ahead and click on the link in my bio and share the page, share it with your friends. We're trying to spread awareness, and turn on the post notifications if you don't want to miss anything. And let me know if you have any questions. So, welcome.